Hi, I'm Hilary, and welcome to ventureLAB Chat Podcast. It's my pleasure to be here hosting as part of the ventureLAB team, and we're here with Chris today. And so I'm going to start by introducing myself really briefly, and then we'll hear a little bit more about Chris, and I'm going to ask him lots of questions today. So I have been a part of the ventureLAB team for several years, and one of the great parts of working with our investment programming is that I get the chance to work with founders who are navigating the capital investment work. Part of what brought me to that is a decade of work in both as a founder, but also in corporate adoption of technologies. And I also run an investment firm called Audaxa Ventures. So, Chris, I'm going to start by asking you a little bit about yourself. And I want you to tell us a little bit about InventoRR MD. So tell us how you got there and tell us a little bit more about where you are.
Sounds great. Thank you. I'm Chris Bass. I'm the CEO of InventoRR MD. And we founded InventoRR MD about 7 years ago with myself and two surgeons at St. Michael's Hospital, Dr. Ori Rothstein and Dr. João Rezende Nato. We developed a portfolio of IP based on their research and their experience in the hospital. And we moved that forward to the AbClo product, which is our flagship product that we're selling today across Canada and the US. That really helps with the management and closure of intentionally left open abdomens, which are massive midline incisions. I always say if you're seeing our product, you're having a really bad day. But we hope that AbClo, improves your outcomes long term.
Great. And can you tell me a little bit about how InventoRR MD came together? So maybe the story of the business and where you are now.
For sure. So Dr. Rothstein recruited Dr. Rezende Nato from Brazil, where Dr. Rezende Nato was the chief of trauma at one of their largest trauma centers. And he brought him to be a professor and a trauma surgeon at St. Michael's and University of Toronto. João brought a bunch of ideas that he had from his extensive experience in Brazil dealing with a challenging healthcare system where there's a lot of resource scarcity and a lot of volume. And, kind of like in Canada, there's some pretty similar challenges and, had all these ideas and wanted to move them forward to make a meaningful impact. And AbClo was one of those.
Great. And if you could tell us a little bit about what brought you to the team. It's really interesting to hear about the story of two doctors from different parts of the world coming together to innovate and work together. What made you, and tell us a little bit about your background and what brought you to the business?
Yeah, so I've been founding startups pretty much my whole career. This is Inventor's the third startup I was a co-founder of. And I was exiting a previous startup, and I knew Dr. Rothstein personally, and he said, "You've got to meet João, Dr. Rezende Nato. He's got these great ideas." And I met João, and within 30 seconds of meeting him, he had a video of his heart plug device, which was for penetrating cardiac injuries, and he showed a video that was quite graphic to somebody in 30 seconds of meeting them. And I was quite woozy at the time, but not anymore. That was 7 years ago. Right. And, I really stayed because he's such a great person and the ideas were so great. And it's been a pleasure working with him and growing the product portfolio.
Awesome. And when you think about the business, because you really brought a lot of that business sense and that business background and that kind of pathway to commercialization or that pathway to accessing growth, can you tell me what you find that's unique about the business? I think as an investor, we're always looking for founder market fit. We're always thinking about kind of what makes this team the right team. I'd love to hear from you, kind of you coming on with two doctors, what made you drawn to the uniqueness of what you're building as part of the business?
Yeah, I think working with doctors on their ideas is very different than having some ideas and trying to get doctors to buy into those ideas. So having doctors that were so passionate about real world problems that they continually experience and have a strong idea on how to fix.
Yep.
And then once you've got that kind of base, it's trying to just not mess it up at this point, right? It's, that it's a real problem, they experience it often and, the solution is viable. It's it's pulling all the pieces together to make sure you can, get a MVP, get clinical testing, get through regulatory approvals, and then, one of the hardest things I think is transfer that message from, 2 doctors to thousands of doctors.
Yep. And maybe you can tell us a little bit about how you've done that. So one of the things that I think is unique about your business is that you have worked with some really great people, but you've really leveraged, from what I know, the expertise that Canada really has. And so can you tell me a little bit in terms of how you've navigated bringing on really good people, but also kind of the partners that you've been able to bring on along the way?
Yeah, I think, working with St. Michael's, now Unity Health, has been, extremely helpful for the business. I think, the early testing and the early validation and using the product on patients is very challenging to do if you're not, very well associated with a hospital that's willing to push research and innovation forward in a good way. So I think, working with them, having the surgeons who are able to write the ethics protocols, make sure the testing is safe, and then, record and publish those findings is special. And I think really was one of the big differentiators of Inventor and how we've come to where we are now.
That's great. And I think what you're doing is something that a lot of people don't see every day, right? As you said, people see it on their worst day and hopefully don't actually see it if I'm thinking about what you do. My question is, as you reflect back on your journey, do you have a favorite project or milestone that has kind of helped you get to this point in Inventor's path? Yeah,
I think the first time AbClo was used by a surgeon that wasn't one of the co-founders was pretty awesome. The first time it was used and it worked was also pretty cool, but when it was used and positively received by somebody who hadn't invented the product, that was pretty exciting. And then the first time somebody decided they liked it so much they wanted to buy it, was pretty cool.
Right. And having started in Toronto as a Toronto kind of based innovation, where has it now been used?
Yeah, so we've been used essentially across Canada.
Yep.
BC, Alberta, we're getting into Saskatchewan, Ontario. We've had some use in Quebec and out at Halifax. And then, we've done a lot of work on the East Coast of the US. So Pennsylvania is definitely our highest state in the US, but we also have, users in Virginia, some large systems in both those regions, and then Texas and California as well.
Wow, that's a huge reach for an innovation that 2 doctors, built together and is scaling. I'm curious, what does it look like to be working in a Canadian ecosystem and an American ecosystem, and how do you look at them differently?
Yeah, for sure. I think our message when we're selling them is slightly different. I think, resource constraints are much more prevalent in Canada. And I think telling the story of how, we're going to give you better patient outcomes, but we're also going to save you a bunch of money,
yep.
And lead to efficiencies is really important. I think, in Canada, we see, all the hard good savings of like, what are we directly replacing is very important. In the US, we kind of talk more about long-term effects and like ICU stay reductions, patient quality scores and reherniation rates.
What I think is interesting, just from what you've shared in terms of your story, is navigating what you shared. Is like the Canadian medical system and the decision making is quite different.
Yeah.
Frankly, than how the U.S. works. I did my MBA in the U.S. and I've had the pleasure of working with the Mayo Clinic and a couple of other organizations that in the U.S. are leaders, but they make decisions differently.
Yeah,
frankly,
the speed and the efficiency and the commitment to a decision is definitely faster. It takes a long time to get adoption in Canada, and unfortunately, you spend a lot more time for a much smaller system, especially for something like us. It's a trauma and acute care based product. So
right.
Luckily we don't see as much trauma in Canada. So it's a significantly smaller market. But in the US, we also see, it's usually a losing billing code for us. So hospitals aren't making money on these
Right.
cases in the U.S., but they really value that we're helping them lose less.
Right.
We're making it a profitable code, and that
Right.
the profit-driven aspect of the U.S. healthcare system is interesting.
It's just different.
Yeah.
And someone put it recently to me in a way that, still driving towards the same outcomes and patient outcomes that I think is really critical. Saving lives, quality of life, time to be able to respond are all critical in all systems. But how you communicate that to different systems or decision makers is different. So you shared it's about saving time or saving money in the Canadian system, whereas it might be about something slightly different in the US system. And that's just how decisions are made. And I think one of the things that I'm reflecting on is in many ways, you are leaders in the Canadian medtech space. And I'm curious what reflections you've had in terms of where Canada is a leader from a medtech perspective, because you've been navigating that for a couple of years. What particularly equips Canada and businesses like yours to be leaders globally?
Yeah, I think the research and the quality of research and the research programs is definitely, a massive strength of Canada and Canadian research and Canadian commercialization. I think where the U.S. has an edge up is probably in the what's after research and what comes next and how to, get this product in front of thousands of people and thousands of hospitals. But you can't do any of that if you don't have the good base and the good research.
Yep.
I think you see in the U.S. Lots of companies, and they launch a product, they get regulatory approval, and they have no clinical evidence to support it.
Right.
And you think you've done all these good things, and then you run into a wall of, well, where is your 3 clinical studies? Whereas in Canada, you run your 3 clinical studies, and now it's taken you a lot longer. But when you actually get to market, you have the things you need to succeed in the market.
That's great to hear. Now, I know that you've been navigating the capital side, right? So you're at that key part in your business, and that's one of the ways that you've had the chance to work with ventureLAB is through our investment program. And I'm curious, your path, every path for a business in navigating capital is completely different and unique. And yet there's a lot of lessons learned that I think are great, especially for, a podcast or for a conversation. And so I'm curious, Tell me a little bit about where you are now in your capital journey and what's next.
Yeah. I think capital raising is always an important aspect of it. I think, the programs here have been very helpful in that. We always have a round open, I say. We're never too proud or anything to take extra money if there's people interested. This is I'll call it our 3rd round of financing. Okay. I think we've raised approximately $3 million over the last, 5 years. We try and run very efficiently, very lean, and not to expend capital. We've taken a choice to try and focus on sales growth, organically and sustainably versus raising a bunch of money and attempting to outrun your burn with sales growth. Right. So, we've accepted a slightly slower growth cycle, we think, than raising a bunch of money. But that's kind of been how we've been patient and persistent throughout. And we're sticking with that formula.
And how have you, throughout that process, you're an experienced entrepreneur, you've had exits. How have you approached this business specifically in understanding, as a medtech company, with the partners that you have, the team that you have, the important role that capital plays, but not the only role that capital plays, I think is kind of the nuance of it, right? And so I hear you in saying it's the right timing and the right people. When you think of the role of taking in external capital, why is that important at this stage?
And I think, raising money to bring more talented people to the team is definitely usually why we've raised money.
Yep.
Initially it was for the tech, but after that, it's always been about bringing talent on. Mm-hmm. And without good talent, you can't go very far, very fast. So it's definitely important, and I think it's a tool for growing the team is definitely why I like to raise capital.
Awesome. And with this round that you're currently doing, excuse me, with this round that you're currently doing, what are some of the outcomes that you're looking to drive with it? Because I think you've told us a little bit about the story of the business. What is it that you hope to be able to get out of this next round?
Yeah, we're currently raising to kind of grow the sales team a little bit, as well as keep our sales growth to the point where we'll be cash flow positive.
Awesome.
That's kind of our goal. Yeah.
And you worked with our capital investment program. What were some of the pieces that were really useful for you in navigating that?
Yeah, I think it's always great to have multiple opinions on your presentations and your pitches. I think everybody brings valuable insights, and you pitch a lot and you kind of get tunnel vision into your story, and you start, forgetting that there's other ways to tell a story, and there might be better ways to tell a story, and then access to people interested in hearing that story has been really helpful.
Awesome. And I know you've had access to some. One of the key things that I've learned working at ventureLAB is how important it is to have a network of investors who know and understand hardware. Mm-hmm. And so part of ventureLAB's story is building a hardware investor network and bringing in those investors to the table and being able to work together. And so my question to you is, as you're looking for those investors and as you're looking for the places, what was so interesting or relevant to you when you were looking at the hardware investor network?
Yeah, I think, specificity of your investor is always important. In healthcare and medtech, there is there's often buzzwords and tech and AI is very prevalent these days. So having people who aren't looking specifically for, checking a box on your AI driven solution and actually, care about kind of niche or simpler, scalable but small solutions for specific problems is extremely helpful. The amount of times we've pitched large groups and, everybody's just looking for the AI solution or the big data solution, and we don't fit, the investor criteria is prevalent. So having, a fairly unique and specific group, looking to learn and invest in companies that meet that criteria is very helpful and unique.
MedTech is hard.
Yeah.
It's a hard tech. We say hard tech is hard to raise capital. And yet I will also say as an investor, software, and I worked as a product manager in a software company. It's always seen as a little bit easier or faster to scale.
Yeah.
And yet if we really think about it, the back end of most software is hardware. For sure. And so there's this direct connection between hardware and software. And so if we look at hardware and we recognize medtech and kind of your business is in this medtech space, but you're still dependent on a lot of different technological pieces. So my question to you is, if you were to say what the biggest myth was in raising capital for medtech or even with medtech, what would you say that is?
Yeah, I guess that it is possible to raise money for uncool and untrendy ideas. It takes a little bit longer. You've got to find the right people, the right partners, the right message. But there's still a pathway to raise money and be successful with an idea that isn't the flavor of the month or trendy or really exciting.
Have you ever thought of going on Dragon's Den?
I have not.
Okay. So, and I'm going to use that example because I think a lot of the ventures that are on Dragon's Den are consumer facing, are the things that we're used to buying or the things that customers, are very familiar with. I don't imagine your business is going to aim for a TikTok viral thing. So I think going back to that myth piece is, there's a different path to success. And in medtech, that looks a little bit different. You bootstrapped.
Yes.
So maybe tell me a little bit more about kind of how you navigated that and then when you decided to raise capital.
For sure. I think, one of the challenges with medtech is you're going to have to raise a lot of capital eventually, probably. And if you start raising money too early, you run out of the ability to raise more eventually, right? You can only give away 100% of the company at some point. Yeah. And the temptation to throw money at early product development and early research specifically is very high, right? It's hard to find the partners to do medical research for free, but it is possible, versus paying a large institution in the US a lot of money to run your clinical trial for you. So we, through our partners with St. Mike's Unity Health and the co-founder doctors and surgeons, took our time, moved slowly, but for virtually no money, we were able to publish, peer-reviewed clinical trials and get the supporting data to be ready to launch a product successfully without raising a bunch of money.
I mean, I think that's really great insight. And I think for those people who might be listening to this, I think it's important to acknowledge that a doctor doesn't just come up with an idea and decide suddenly the next day that they're going to go find money for it, right? Like, I think that's the part that there might be a bit of a myth around doctors able to do all these things. Can you tell us a little bit of the story of how the two doctors who ultimately built this met and how they came to wanting to build it in Canada?
For sure, yeah. So they are both, pretty prolific researchers, and they met through their research. Zhao was in Brazil and doing a lot of good research there, and Dr. Rodstein-Ori was at Unity Health St. Michael's as the surgeon in chief. And through the collaboration of their research and sharing their stories of surgery, Zhao ended up coming to Canada to work with Ori at St. Michael's, and once he was here, the hallway medicine kind of makeshift ideas that he'd been using in Brazil to treat patients in a relatively poor public system, the challenges were still here, and the resources were around to make those more makeshift solutions more viable and more acceptable in a Canadian system and North American system.
What a cool story. And I think what's so valuable about that is we often talk about, and we were talking about it before, of how hard it is sometimes to raise capital, or how even investors in Canada don't always take the risks that we wish they would. We wish they would.
Yes.
And yet Canada was where this innovation, only in Canada could this innovation have come to life.
Sure. Yeah.
And so if you can speak a little bit, and I think we're all very hopeful in Canada, but what makes this a business that could have only been founded in Canada?
Yeah, I think the blending of the academic and the business sense is very strong. I think, we've set up through the University of Toronto and Unity Health, a system to bring research forward to a commercial product. I think it's it's the early stages, but moving it forward one at a time is definitely the way to do it. I mean, I think it kind of echoes our story a bit. We started with 9 pieces of IP, a lot of products kind of scatterbrained, and we decided the best way to prove that you can bring a bunch of research forward is to bring one piece forward instead of trying to bring a lot of pieces forward gradually, is just to pick one and get it all the way there, get it across the finish line so that you can then move the next one across the finish line.
And what made you choose this one?
Oh, that's an interesting story. It wasn't our first pick. We had a tracheostomy device, which is exploratory airway surgery, and that was in its clinical trials phase, and COVID hit, and nobody wanted to do experimental airway surgery suddenly, and I don't blame them. So we pivoted to this device, and I think, to be honest, it was a very good choice.
So timing,
yes.
Right? It's it's one of those things that founder market fit is really, really important. Founding team market fit is really important, but also timing.
Yeah.
Why now? Why this innovation? And I think we've seen a lot of that in medtech, especially in medical. And so my question drawing on that is, what's one of the greatest skills that you have as a CEO running a company in a space like this?
Yeah, I think, the willingness to be flexible, but also stick to it, and be patient and persistent, and know that, and especially in the medical field, things are going to take a lot longer than you wish they would, and they'll get there eventually. And as long as you can stick around to be there when they get there, it usually works out pretty well. I think, the great thing about the medical space is, everybody's usually in it for the right reasons and very positive and helpful and great to work with. And there's just a lot of not barriers, but things that result in things taking a long time, usually for very good reasons.
It's one of the things that I learned a couple years ago when working in the medical sector. I had actually wanted to be a doctor early in my career, and my mom got me to go and volunteer in an ER department in my first year of university. And I remember sitting there and wondering, is this the environment that I want to work in? And I learned a lot from that experience. Now, you've obviously moved from exiting in another industry to coming into this industry. What's something that you were surprised by coming into the medical or medtech space that you think other people might not know?
It's a very different space for a lot of reasons, but I think the level of knowledge, that so many people have in the space, a lot of other spaces, you're not constantly dealing with doctors and PhDs and researchers. So there's lots of strong opinions, lots of strong knowledge base, and kind of how do you fit something new into something that is relatively established? I mean, doctors learn and they don't entrench, but they know what works well for them and their patients, and trying to add something in or make a small tweak to a practice can be challenging and for good reason sometimes.
Yeah. And I recently heard someone who works in the space say to me, they said, before COVID, everyone said, no way, we can't do that. We can't make that change. And then this event happened, and suddenly within a day, everything changed. Or suddenly within, 12 hours, these systems that everyone had said there was no way that they could do it happened overnight. And so I think there's a bit of a shift happening, and this is what I'm experiencing, and I'm curious to hear from you. There's a shift happening where, yes, persistence, yes, consistent messaging, yes, consistent mission, but there's a shift happening in terms of people understanding why change is needed. Are you seeing that? Is your team experiencing that?
For sure. I think, especially at the surgeon level, the willingness to just kind of do what we've always done is less acceptable. There's, I would say, a higher percentage of surgeons who want to kind of push the envelope, want to be on the cutting edge, want to do the best they can, because they always do the best they can.
Right.
But, kind of willing to put more of, because it's really about their effort, right? To get a medical device into a hospital, a surgeon who's already doing a great job caring for their patients has to put a lot of their effort in to work with their institution to move your product into their system. And I think more and more doctors are willing to go even above and beyond and help with that process.
And how do you see your tool and your innovation helping doctors fulfill their own missions? Which in many cases, that's the thing that I've learned in both the Canadian and the American and the global health space is everyone who gets into medicine is trying to improve people's lives. Mm-hmm. And so every day they've got someone's life in their hand and they're thinking about how do we improve their lives. So what makes them want to bring your innovations into their hospital and their very busy schedule? What have you found convinced them or got them motivated to bring in a new tool?
Yeah, I think it's a combination of improved patient outcomes, but also giving them a bit of time back, efficiencies in their day so they can go do more things, because that's one of the surgeons are always pressed for time. There's never enough time in the day for all the things they have to do. So saying, look, you can always close an open abdomen. There's always a way. You can do many different things to get it there, but we're going to get you there easier and quicker, right? You're not going to have to spend 8 hours in an OR doing a fairly complex surgery to get this closure. You're just going to have this non-invasive device on in the ICU, and then when you want to close them, takes you half an hour. So, and then you can go do other amazing things with those, hours we've given back to you. So that has seemed to resonate quite well.
Yep. And you've talked about having good partners and a good team. And I think a big part of that sounds like it's also the doctors that you work with. Can you tell me what makes a good partner?
Well, I think, the enthusiasm, especially in the medical space, it's a long road. Mm-hmm. So, a partner who believes in the vision and has the enthusiasm to, get out of bed every day and work to improve a device, a company, the patient, the outcomes, is really important, because it's, there's a lot of hurry up and wait sometimes in this field too. And If you're not enthusiastic and you're sitting there dragging your feet because you're waiting for a FDA submission or a ethics board approval or anything, it's a long road to be not enthusiastic about it.
And so if you were to talk to Chris 7 years ago, before you decided to get into this, what insight would you offer to Chris then?
Yeah, I mean, I'd say we weren't always patient. There were times when we wanted things to go faster, and being prepared that you're going to have to go slow in certain areas, and doing it the right way is better than doing it quickly, I think, especially in medicine.
Yeah.
Trying to rush something is very risky, and taking the time to do it right is definitely worth it.
And there's a reason why some of the measures and controls exist.
Yes.
I think we would all hope that those same measures would be taken if it was our life there on a table.
Yes.
But we also recognize that we want the best medical options available. I think it's that dual side, right? And so I think it's such an interesting space, and it's an area we need more innovation. We see a lot of women's health. We see a lot of opportunities for shifting and representing not only different innovations, but we also see the need for different people to be a part of that process. And so I'm curious, if you were to offer advice to other founders who are navigating medtech innovations, they've got a medtech innovation they're trying to bring to market, what advice would you have for them?
Yeah, I'd say, don't go it alone. I think, having partners is really important. I think a diverse skill set and knowledge base and experiences is important, and no one person can be all of that.
Right.
But yeah, finding good partners who believe in what you're doing and how you want to do it is definitely important.
And so your story is really, it talks about the importance of a university and a hospital that not only has access to lots of resources, but also has a research facility and has doctors who have the mandate to do research as part of their job. Can you maybe talk more about, it doesn't have to be that specific relationship, but as a new founder might be navigating, who do I pick as a founder? From your experience, can you tell the story of what's made your partner such an effective one?
Yeah, I think, being passionate about the problem more than the solution, I think, is important, right? We didn't start out to make AbClo work. We started out how to solve, complex open abdomens failing to close. And not coming to a surgeon and say, I've got this product that's going to solve this solution, and saying, like, what problem are you facing, and how can we, take something to solve it, I think is really important. I think, founders who aren't have a strong medical background often see a problem that they don't always fully understand and build something to solve that. And so finding a partner who can, tailor that and critique that, I think helps you not build something that you're then going to have to tweak much further on than you probably would have liked to.
That's great. And final question before we jump into the rapid fire, and then we'll go through a few rapid fire questions. You've navigated capital on a number of businesses. You've raised, you've closed, you've exited. Closed, exited, same thing. Sometimes. So you have the benefit of being a multi-time founder, and that's something that in Canada we see as a really great thing, because you have all those benefits of learning. For a founder who hasn't navigated raising capital or who hasn't navigated capital before, what would you say has been really valuable for you, and what advice or insights would you offer to other people who are navigating raising capital?
Yeah, I think, finding groups and investors and groups like this that have an accurate fit with what you're trying to do is really important. Finding a Dragon's Den investor per se and pitching them a niche medical device is a waste of everybody's time usually.
Fit is important.
Fit is very important. And then finding fit with partners like ventureLABs who can put you in front of the right people, because getting in front of the right people is challenging. So yeah, I would say fit is definitely finding partners and investors that fit with your vision is more important than talking to 1 million investors, I think.
So I'm going to ask you a granular follow-up on that,
Okay.
which is, I think a lot of people don't know that if you are looking for venture capital versus angel versus family office, that they all have different kind of return expectations and even timelines. And so when you're having those conversations with people, both around thesis of their fund or thesis of their investments, as well as kind of the time horizon, how do you approach that?
Yeah, I think, one of the most important things is making sure you match what an investor is looking for in terms of, I think, timeline and return for timeline. So, one of the challenges if you're looking at a typical 10-year horizon in venture funds and you're in a medical device and you're not right at the very beginning of that fund, it might be a bit of a challenge. Right. And then for us, the return expectations is something that venture has not always been a great fit for us, but I think we counter that with other groups when we're talking about, de-risked through peer-reviewed academic work and a bit more of a stronger base than a shooting star idea.
Yep.
And, market expectations and kind of end goal, right? I think there's what a successful outcome looks like for an angel versus a venture capitalist versus a family office is very different. And you don't want to be telling a venture capitalist we're going to do, 4x return in 12 years. And that's just not a great way to have a conversation with a venture capitalist.
Well, and it's really about building trust and building accountability over time. And I think a lot of people miss that it's a very long-term relationship that you're establishing with someone. And so I'm curious, and for those who are listening, who for you is your ideal investor? If you can tell us a little bit.
Yeah, I mean, we've taken money from all kind of spectrum, I will admit.
What are the common characteristics of what makes a good investor in your business?
Yeah, I think, understanding our mission and our goals and kind of, that we're not going to be a unicorn. This isn't $1 billion company. AbClo, isn't going to be $1 billion company most likely, but, you can still do good things and, give everybody a good return at less than $1 billion, if you only take in a little bit less money.
Awesome. Thank you. And now I'm going to ask you a few rapid fire questions. So I understand you have a relatively young one at home.
Yes.
And so imagine that you are describing what you do to a 10-year-old. How would you describe your business to a 10-year-old in a couple of words?
Oh, man. Taking ideas to help people and making them a reality.
Great. And in a couple words, what's your mission?
To improve patient outcomes and save hospital resources so they can deliver more care.
Amazing. And if you could describe 2 or 3 softwares that you use every day in your business, which ones would you name?
We use QuickBooks a lot. That keeps me on top of things.
That's your finance angle.
Yeah.
Yep.
And then Pipedrive is kind of our CRM. So we track all the doctors we meet at trade shows and progress of, are they using the product in a demo capacity? Are they evaluating it? Are they purchasing? Okay. Those would be the 2 main ones. Yeah.
Speaking of apps, what is an app that you are using in your life right now and very regularly?
I think the thing I'm using the most is called Huckleberry Connect. It's a app for tracking your child's eating and sleeping and bathroom usage, etc.
So very relevant.
Yes.
Very, very relevant. What's one thing you can't live without?
Ooh. Unfortunately, it's probably my cell phone. I think the amount of calls I get from doctors and surgeons and team members is pretty high. So it's a key tool.
That's great. And if you could think of, because being an entrepreneur, you need to constantly be motivating yourself. How do you keep yourself motivated?
I think just, seeing the outcomes and the improvements for patients has been really really motivating. And then, the family and friends who've supported along the way.
And what's the outcome you're most excited about?
I think, widespread adoption as AbClo as a standard of care and really changing the slightly negative rhetoric around open abdomens as a surgical solution and a toolkit.
Awesome. And what is your hope for your business moving forward?
I think we'd like to find a large partner to make sure AbClo can be available to anybody who needs it, because we're limited by the team size now about how wide we can get AbClo.
That is great. And I think a good food for thought as we wrap. Chris, thank you so much for your time. Thank you for sharing the stories of your business, your stories as an entrepreneur, and your words of wisdom for others. Do you have any final words that you want to share?
No, I think that's been great. Thank you for guiding me through.
Thank you, Chris. A pleasure.